Xiao can be translated in both ways. So stop smiling or sudden smiling, sudden smile. It can be interpreted in both ways, and it stops abdominal pain by blood stasis. Usually, the formulas for reproductive system is commonly used for gynecological disease, but Xiao can be used epigastric pain too because of this Ulingji. Ulingji is for only excessive condition, blood stasis, but it is commonly used for epigastric pain and also low abdominal pain with the reproductive system problems. This is kind of feces of animal, the kind of squirrel. So I'm not comfortable with using this Ulingji. In my clinic like 20 years ago, I used a lot of Ulingji for what? Food stagnation. Nowadays, I do not use this. Who knows? There's any unknown substances in feces, even though that is processed. And Ulingji can be used for epigastric pain and lower abdominal pain, so any abdominal pains. Only under condition, excessive blood stasis. So it dispels blood stasis. What is the quality of pain? Sharp, fixed pain. This is blood stasis pain. And it can be also used postpartum bleeding, retention of lochia, goro, and abdominal pain. So compared to Shen Tang, this is for only excessive condition. Shen Tang is basically deficiency condition, to which herb is contained in largest amount in Shen Tang? Dangui. So Shen Tang, even though we learned that formula in the category of invigorating blood, but it has a strong function of tonifying blood. But how about this formula? Xiao does not have those tonifying blood. This is only for excessive condition. So it is not the medicine should be taken on regular basis when there is pain. Whatever the condition is, epigastric or reproductive system, any pain with a sharp and fixed quality blood stasis. And this Ulingji can be substituted with Yanhusu. This is my recommendation, my personal recommendation, Yanhusu. Do you remember motilaton? That biomedicine, motilaton? That is for functional dyspepsia, indigestion. Yanhusu is proven herb releasing epigastric pain and blood stasis. Yanhusu. So it is similar to Ulingji. So you can substitute Yanhusu, but I will not use this Xiao. It was a very famous formula in old days. Not that old, just 20 years ago, we used this Xiao a lot. But I would recommend using Jiawei Sheng Hua Tang with Yanhusu. This is Shen Tang with Yanhusu and Mudampi and Rogui. So when the patient have a deficiency condition, Shen Tang is enough. But if there is severe pain, add Yanhusu. And Danshen in Danshen. What is Danshen? Danshen. It is not ginger actually. This is not ginger even though it has a name Shen. So this is Danshen. It's all red. It looks like ginseng, but it's red. That is the reason they named Danshen. So Danshen invigorate blood here. So regulate blood with Danshen and regulate qi with Sharen and Tanshang. This is Danshenin. So it moves qi and invigorate blood. So it is a common strategy. So warming and moving. Warming inside and moving qi always partner with invigorating blood. And Tanshang is not the commonly used herb. This is sandalwood. What is sandalwood? And it is used as an essential oil too. This is Tanshang with a beautiful fragrance. It is not resin. Chenshang is resin, but Tanshang is the wood itself. It is Tanshang. So what if you do not have Tanshang? I think you can substitute with Mushang. So Danshen, Tanshang, and Sharen. These regulate qi and these invigorate and regulate blood. Tanshang is commonly used. Sandalwood oil has been used as an antiseptic and astringent for treatment headache in Western herbology. So it dispels blood stasis and stop pain just like Xiao. But this one is more focused on chest, heart. So Xiao is more focused on lower abdomen. Epigastric is a common and lower abdomen. But Danshenin is usually used for heart. So like preventing stroke and the history of the stroke, angina pectoris, so those conditions. And epigastric pain is the common point between Xiao and Danshenin. And Danshenin is more important formula. And Danshenin should be used with caution in patients who have bleeding problems. And also you need to consider drug interaction too. A large dose of Danshen can prolong bleeding. So before surgery or dental procedure, you should concern about using Danshen. And I told you there are many researches about Danshen. Danshenin is well-known formula widely used in clinical practice for treating coronary artery disease, angina pectoris, and even preventing stroke like aspirin. And Danshenin exerts significant cardioprotective effect against acute ischemic myocardial injury in rat, and possibly through its anti-inflammatory and antioxidant properties. Actually, there are many researches about Danshen. Please refer these researches. They are all written in English. And this is another famous product, patent product of Danshen. And you can use this in United States. You can buy this in Amazon. And this 천사력제약. This is a famous pharmaceutical company in China. Danshen and Sanchi. Sanchi has an effect of regulating blood. Stop bleeding. It is once used to stop bleeding and also invigorate bleeding. Sanchi is used. 이게 3칠근이에요. 3칠근. Sanchi. Sanchi means 37. And I personally use Danshen dripping pill more than Danshenin. So this is a very widely used herb formula in China and all over the world, even in Korea too. Danshen dripping pill was still better than isosorbide dinitrate in treating angina pectoris and diabetic neuropathy, retinopathy. One meta-analysis of RCT showed a good sign of diabetic retinopathy, 당뇨성 망막 질환, and chronic heart disease. So it is very hard to prepare all the formulas in a traditional way in your office. So you should know all these kind of patent formulas